Yes. So, when should you have your wisdom teeth removed? I get that question quite a bit. I like to start looking into this starting at around the age of 13. I know that sounds young. Dentists will sometimes say, let's just kind of watch them. Or parents will sometimes say, do you think we should wait a little longer? Maybe they'll grow closer to the surface. And the answer to that question, the answer to both of those scenarios is waiting. You're simply waiting for the wisdom teeth to get bigger. You're just waiting for the roots to grow larger. You're waiting for the wisdom tooth to become a little more involved in the surrounding structures than we would like them to be involved. Now, in reference to the question of why don't we let them erupt a little further, the problem with that situation is they're very unlikely to erupt any further than they are at that moment. And the reason for that is this. If you think about where a wisdom tooth is, it's typically tucked under the bone and it's behind that last tooth that you can feel in your mouth. And the crown of the wisdom tooth is generally pushing up against that tooth. So there's an obstruction there. It can't actually erupt any further. So what's happening now is there's a stall that has occurred. The crown of the wisdom tooth is just sitting there, and now the roots start developing. Well, they're just going to grow down further, closer to the nerve that supplies sensation to the lip and the chin. So the wisdom tooth is not likely to erupt any further. Even if we wait and watch it, we're just waiting and watching for it to become more involved in the surrounding structure. So consequently, I just like to get them out starting around the age of 13. 13, 14, 15, those are ideal ages to have the wisdom teeth taken out. And patients tolerate that procedure very, very well at a young age. In fact, if you look at the literature on removal of wisdom teeth, you will find that the complication rate rises dramatically as the patient ages. In fact, starting at about the age of 20, we start seeing that really accelerate. Now, what we also have been seeing in our practice is a lot of adult wisdom tooth removal. And the reason for that is these are folks that have waited and watched, and now they have an issue. The good news is we can take care of those problems. There are lots of solutions for adults who have wisdom teeth that are now causing problems. And the best news of all is you can have this procedure done in the office while you're sleeping in a very safe and comfortable environment. We do IV sedation in the office. We have medication we can give you ahead of time if you're nervous about getting an IV. Our specialty is removing wisdom teeth in an office setting for people that are nervous. That's what we do. We do the easy cases, we do the hard cases. We take care of people that have never had a procedure before. We take care of people that are afraid of having anesthetic. We're all in the same boat. No one likes to have their wisdom teeth out. No one likes to go to the oral surgeon. But our job is to take great care of you, make sure that you're safe and comfortable. And we do a great job of that. So if you're interested in having your wisdom teeth out, just give us a call at the office. You can find us online at oklahomacityoralsurgery.com. You can Google us, Oral Surgery Specialists of Oklahoma. Our phone number is 405-7 call. You don't need a referral. You can just call us directly. We'll sit down, talk about it, and let you know the good news. So nothing to worry about. Just come on in and let us take a look.